Hello everyone, welcome to my YouTube channel. This is Dr. Hajira. Today I am going to talk about the thorax. As you can see in the picture, the thorax is a part of the body which is between the neck and abdomen. Thoracic cage and its wall have the shape of truncated cone, being narrowest superiorly with the circumference increasing inferiorly, and reaches its maximum size at the junction with the abdomen portion of the trunk. The thoracic cage has divided into three major spaces. The first is the center compartment, which is named as the mediastinum, that houses the thoracic viscera except the lung. And on each side there is right and left pulmonary cavity that houses the lung. So now let's talk about the skeleton of thoracic wall. The thoracic skeleton forms the osteocartilaginous thoracic cage, which protects the thoracic viscera. The skeleton of the thoracic wall includes 12 pairs of ribs with the costal cartilages and 12 thoracic vertebrae and the intervertebral disc that interpose between them, and also it includes the sternum. So now let's talk about the ribs. The ribs are concave flat bone that forms the most of the thoracic cage. There are three types of the ribs, and that can be classified as a typical and atypical. So now let's talk about the types of the ribs. As you can see in the picture, we have three types of the ribs. First is the true ribs, second is the false, and third is the fluting ribs. The true ribs is also known as the vertebro-sternal ribs, which includes the first to the seventh ribs. So why we call them a true ribs? Because they attach to the sternum directly with their own costal cartilage. The second, we have the false rib, is also known as a vertebrochondral rib, which includes 8, 9 and 10 ribs. Why they called false? Because they are indirectly attached with the sternum. First, their costal cartilage are attached with the rib of above, which means with the seventh rib, and then they are indirectly attached with the sternum. And the third, we have the fluting ribs, which also known as the free ribs, which includes 11 and 12 ribs. These ribs are not even connected indirectly with the sternum. Instead, they end up in the posterior abdominal musculature. And then we have the classification of the ribs. We have two classifications for the ribs. First is typical and the second is atypical. The typical includes the head, neck and the body. The head has two facets, so that's separated by the crest of the head. The neck connects the head with the body of rib at the level of tubercle. The tubercle is located at the junction of the neck and head. The tubercle has two parts. One is the smooth articular part that articulates with the transverse process of the vertebra, and the second part is the rough non-articular part, which provides attachment for the costo-transverse ligament. And then we have the body. The body is a thin, flat curve, markedly at the costal angle. The most important part in the body is the concave internal surface of the body that has the costal groove. In the inferior border, it has some protection for intercostal nerve and vessels. The typical ribs consist of the 3rd to the 7th ribs. And now we come to the second classification, that is atypical ribs, that consist of the first rib, 2nd, 10, 12. It has a single facet on its head that articulates with the T1 vertebra and has two transversely directed grooves in its superior surface for the subclavian vessel. In the second rib, it has two facets for the articulation with the bodies of the T1 and T2 vertebrae. On its upper surface is tuberosity for the serratus anterior muscle. And now the 10th rib have only one facet, and the 11th and 12th rib have no neck or tubercle. So now we are coming to the next. Now we will talk about the sternum. Sternum is a flat elongated bone that forms the middle part of the anterior of the thoracic, that gives the protection for the mediastinum generally and particularly for the heart. The sternum consists of the three parts. One is the menaberium, second is the body, third is the xiphoid process. Menaberium, in its superior border, there is a jugular notch, which is also known as a suprasternal notch. The menaberium with the body is connected by the junction is called menaberiosternal joint. The body is a thin and a long elongated bone, which is connected with the xiphoid process by the xiphoesternal joint, and the body of sternum is located at the T5 to T9 vertebrae. And then we have the smallest part is known as the xiphoid process. The xiphoid process is located at the T10 vertebra. The thoracic cage has two openings. One is the superior opening and second is the inferior opening, which is known as the superior aperture and inferior aperture. The superior aperture is the narrowest, that is a passageway and allows the communication with the neck and upper limb. The inferior aperture allows the ring-like origin for the diaphragm. The superior thoracic aperture is abounded posteriorly by the vertebra T1, laterally by pair of rib first and their costal cartilage, and anteriorly by the superior border of menaberium. And the inferior aperture is abounded posteriorly by the 12th thoracic vertebra, anterolaterally by the 7 to 10 joint costal cartilage, and anteriorly by the xiphoesternal joint. We will see you in the next video. Subscribe to my channel so you could not miss any of my videos and YouTube channel.